Hey everyone, Dr. Sorin here with Idaho Pain Clinic. I want to talk today about neuromodulation, or it's otherwise called spinal cord stimulation. So this is a therapy or treatment that can be used for people with lower back pain or radicular pain, which means pain into the limbs, and it works very well. Another use of it is also for diabetic peripheral neuropathy, because not only does it help with pain, but it can also increase blood flow to the limbs, and it can also be used for chronic regional pain syndrome, or CRIPS. So what are some of the benefits? Let's talk about it. Number one, the obvious one, which is pain relief. That's why we put them in there. The way spinal cord stimulation works is it stimulates directly up against the spinal cord. So if you think of the way your body is wired, so you've got your brain going into your spinal cord and then going into the extremities. Well, when you have a pain signal coming from your leg going to your spinal cord and up to your brain, it continuously shoots this pain signal. So what a spinal cord stimulator can do is it can stimulate that and basically inhibit the body's ability to transmit that pain up. Think of it almost like white noise. So sometimes if your neighbors are real loud, you'll get a white noise machine and it washes out the noise, and instead you have this white noise. It works in a similar fashion. And now they even have high frequency stimulation, which means that it may even be perception threshold. So it means you may not even notice it. So the frequency is so high that you may not notice it. So that's basically how it works. It washes out the signal. And some people think, well, I've got a TENS unit. A TENS unit works totally different. A TENS unit is peripheral, external, whereas this is directly up against the spinal cord. So it really does an amazing job of blocking the pain signal and reducing your pain, increasing your ability to, function normally without medication. So number two, it's minimally invasive. So compared to spinal surgery or other types of surgery that may permanently change the way the anatomy of your back, and as they remove parts of your backbone or whatever, if they do a laminectomy or if they do a fusion, this is minimally invasive from that standpoint, in that you do get a lead implanted, but you're not changing the anatomy of the spine. Number three, it can really help reduce the pain medications needed. And that's a huge benefit, because if you think of all the negative side effects, including, addiction, tolerance, dependence, constipation, all the side effects of the medications, reduced respiratory risk, death, all that. So you really eliminate all those, because you can have pain control with a mechanical device that doesn't have all those other side effects of the medications. And lastly, number four, these devices implanted most of them are warranted at least 5 years, and some of them oftentimes last 7 or 10 years. So really, if you get this device, you may be good for 7 to 10 years without having to take medications. Intrathecal pumps need to be filled all the time, so I think it's a huge benefit. You get the procedure once, you have it there, and it works. It can be reprogrammed externally through a computer that you can meet with a representative, and so it's really a fantastic therapy for people that have tried all the other things, injections, or maybe even surgery, and they've kind of been told there's nothing else to do. This is a wonderful therapy. Like I said, it's not the first line, but it works really well, and we've seen a lot of fantastic results. So talk to your doctor and see if these therapies are right for you. Thank you.